At Salina Women's Clinic, we care for all stages of women's health through obstetrical care through the menopausal phase. I'm Shanda Schroeder, nurse practitioner at Salina Women's Clinic.
Well, Shanda, thank you so much for joining me today. First of all, why don't you tell us a little bit about yourself and your practice?
Yeah, well, thank you for having me. I am Shanda Schroeder, nurse practitioner at Salina Women's Clinic. I grew up in Central Kansas area, obtained my Bachelor of Nursing from Kansas Wesleyan University. Worked as a nurse for many years before I decided to go back to obtain my master's degree in family nurse practitioner. In July will mark 3 years that I've been with Salina Women's Clinic, and at Salina Women's Clinic we can focus on a multitude of different concerns that patients have, whether it stem from contraceptive counseling, fertility planning, fertility issues, obstetrical care, perimenopausal and postmenopausal phases.
Let's talk about the routine visits that you want women to come into. When should they do that? And tell us a little bit about what happens.
Yes, so routine visits or preventative care exams. We do those once a year. A recommendation, it's nice to be able to sit down with the patients, kind of do a review of systems if they have any concerns. Sometimes they don't even know that they have concerns that we can address specifically. At those visits, we can do preventative care screening with cervical cancer, and that is in the form of a pap smear. That starts at the age 21. Also, depending on the patient's age and her family health history, we can then order a screening mammogram for breast cancer specifically. Those recommendations, like I said, that's once a year, but if there's any concerns in between, we would be more than happy to see those patients earlier.
Do you feel that there's one area of women's health that maybe is a little overlooked?
I do, and overlooked, but also feel like it could potentially still be a taboo conversation, is that of the perimenopausal and postmenopause phases. It's interesting, when I sit down with my patients, a lot of them feel like the only symptom that they should have is hot flashes. Right. But when we start having these conversations, they're having a whole list of other issues, which could look like sleep disturbances, mood changes, brain fog, skin changes. So there's a whole list of issues that can arise within these phases. At Salina Women's Clinic, we can sit down with these patients and formulate a specific care plan that can help resolve these issues for them, whether that be in the form of non-hormonal management or even with hormone replacement therapy.
Well, Shanda, thank you so much for coming on the show, and thank you for watching. For more information, visit salinawomensclinic.com and follow Salina Women's Clinic on Facebook.